Happy Wednesday, everybody. Dr. Dan here from Advanced Upper Cervical, and this is episode 4 of Wellness Wednesday. This week's episode is going to be a little bit different than weeks past. We have a big announcement coming from the practice this week. You're looking at our new state-of-the-art 3D imaging. This is a complete game changer, changes everything about the way that we are treating our patients. In the standards of care, the standards of practice have never been higher. So I just wanted to dictate and illustrate a little bit of what it is that the new imaging shows us and how that could impact you. This is the new imaging here. It's a cone beam CT. So you may have seen this in your orthodontist or dentist office before. Essentially, the patient is going to approach the machine. It's about a 25-second scan. It's a tenth of the radiation of standard x-ray that's been previously used. It's quicker, it's safer, it's faster, and the quality of imaging is like we've never seen before. So I'm going to show you what a real-life scan looks like of a patient that we began working with last week. This is the detail of the image that this scan produces. So in terms of seeing what's going on in the neck, there's really no detail that can be left unfound. This image can be manipulated to show every single angle of what's going on in the neck. This patient in particular has been having a lot of neck pain, restricted range of motion, has been getting migraine headaches, and hasn't been able to sleep in the evenings because she can't find a comfortable position. I should add that this is about a 45-year-old female. You can see a little bit of a scoliosis here in the neck curve. Really what's going on here is that quite literally her head is not on straight. Okay, so there's been a big rotation. Looking down the spinal canal here, you can see a rotation at the C1. If I take this image in a more traditional 2D form, we can see that there's been about a 5-degree curvature in the neck, like that. And what that has done is, as that's thrown her head and neck out of proper alignment, the posture has changed, and that's putting a tremendous amount of stress on the rest of the neck, resulting in neck pain in the middle of the neck at this joint and this joint, because it's pulling from here at the top and here at the bottom. So in terms of what we're going to be able to do for her, now that we can see exactly what's going on, we're going to correct this alignment pattern at the top, remove some of that pressure coming down from the bottom, and this is going to be able to be a much more comfortable, much more kind of biomechanically correct neck. So anyways, just a quick story I want to share with you guys. If you're having a neck problem, if you're having a spinal issue, and maybe it's something that's been undiagnosed for a long time, there's been a new breakthrough, and this can definitely help you. Again, this is Dr. Dan from Advanced Upper Cervical Chiropractic, and remember, is your head on straight?